Hello people, in this video we want to look at ovarian tumors, just the classification. We want to classify ovarian tumors, okay? We will not be going into details of any of the tumor. So you know what the ovaries are, so these are the ovaries. So basically they have some tumors associated with them. Look at the normal histology of the ovary. This is what the ovary looks like under the microscope. So when we draw it, this is how we have drawn it. So here you have the epithelium. So the epithelium, you can see it is cuboidal epithelium. Guys, are you able to see cuboidal epithelium? And here you have the follicles developing. So this is the secondary follicle. This is the Graafian follicle, the tertiary follicle. This releases the egg, correct? And apart from this, whatever you see here, this is the stroma. Okay. So what and all you saw? Three components you have seen here. The first is the epithelium. The second you have seen the germ cells, right? And then you have seen the stroma. So based on this, there will be three types of ovarian tumors. You have the surface epithelial tumors, you have the germ cell tumors, and you have the sex cord stromal cell tumors. So some of these are overlapping, as you can see. So from the epithelium, you will get the surface epithelial tumors. From the exact germ cell, you will get germ cell tumors. From the stroma and from this follicular cells, that is the sex cord cells, you will get the sex cord stromal cell tumors. So this much you have understood now. Let's move on. So based on this, you have to understand, now we are talking about the tumors of the surface epithelium. So these are common epithelial tumors. So what are these tumors? You have serous tumors, mucinous tumors, endometrioid tumors, clear cell tumors, and Brenner's tumors. So in this, what and all you should know, at least serous tumors, mucinous tumors, and Brenner's tumors. These three are important. So serous tumors, you have again in this the benign conditions like the serous cyst adenoma. Then same thing, you can have serous cyst adenocarcinoma, which is a malignant condition. So it's a carcinoma. It's a carcinoma because it is from epithelium. So you know why you're using the word carcinoma, because it's from epithelium. In these serous cyst adenocarcinoma, you can actually see sarcoma bodies, okay? So you have serous tumors, mucinous tumors. Now mucinous tumors, what and all you have? You have mucinous cyst adenoma, mucinous cyst adenocarcinoma, same thing. And between this benign and a malignant condition, you have a borderline mucinous tumor. Easy, right? Here also, serous cyst adenoma, serous cyst adenocarcinoma. In the middle, you have a borderline. They cannot classify it as benign or malignant. Easy. Then you have the endometrioid tumor, clear cell tumors, and Brenner's tumor. What are these Brenner's tumor? In this Brenner's tumor, actually, it will be transitional epithelium, okay? Where do you see transitional epithelium? In urinary bladder, ureter, etc. So here there is transitional type of epithelial cells resembling that of the lining of the urinary bladder. So guys, we are done with the first classification that we wanted to see of ovarian tumors. We have seen the epithelial tumors, under which we have seen serous, mucinous, endometrioid, clear cell, and last one is Brenner's, correct? Guys, pay attention here. We're looking at the list again. Serous, there will be serous kind of secretion, mucinous secretions. Endometrioid, it will resemble something like the endometrium. Clear cell, the cytoplasm. The epithelial cells will be very large, with abundant clear cytoplasm. Brenner's tumor is where it is of the transitional type of epithelial cells will be there, which resembles the urinary bladder. So everything you can see is referring to the epithelium. Take a look at some pictures here. Serous cyst adenoma, serous cyst adenoma, mucinous cyst adenoma of ovary. So, and this one is mucinous cyst adenoma of ovary. So, serous cyst adenoma, mucinous cyst adenoma drawn next to each other. You can see that this is the stroma. There is mucinous fluid. That is why it is called mucinous. There is mucinous fluid here, right? That's all, guys. We are done with the first part of ovarian tumors classification, the epithelial. Now where shall we go to? Germ cell? Okay, good. So let's go to the germ cell tumors. Now germ cells mean what? They'll give rise to the exact germ cell. So what they can, here they will give rise to the egg, correct? Or whatever you want to call it, ovum. So here this germ cell means it has a capacity to become a human being, right? So it has the capacity to become anything. So it has all three layers, let's say, ectoderm, endoderm, mesoderm. So here you can have teratomas. Teratomas are things that arise from all three layers, right? Ectoderm, endoderm, mesoderm. So here you have what you call as this benign condition, dermoid cyst. Okay, so this is a teratoma. Here you can see some hair. Right, you can see some hair here. So basically this is a teratoma. So this is a dermoid cyst. This is a benign ovarian tumor. Okay, so dermoid cyst, don't forget. So whenever it's mature, they call it as a benign teratoma, and whenever it is immature, they call it as malignant. So here you have something called as a specialized teratoma. Example is struma overi. Look at the photo here. So first of all, where are we? In teratomas, we finished benign, that is dermoid cyst. Then we saw malignant immature teratomas. Then specialized teratomas or monodermal teratomas. Monodermal teratomas. So it is monodermal. Just pay attention here. They're saying it is monodermal. So probably that's why it is specialized. So here you have struma overi, and another example is carcinoid tumor. Look at struma overi. Inside the ovary, you're finding thyroid tissue, which secretes thyroid hormone and can lead to hyperthyroidism. So the cause of hyperthyroidism in this patient is not the thyroid. The thyroid gland is absolutely fine, but the thyroid tissue is sitting in the ovary, and the ovary is producing thyroid hormone. Very strange, right? Yes, it is really strange. That is what it is with teratomas. Teratoma, what they say is a monster tumor. So it's a teratoma. You can find all crazy things inside this, like teeth, hair, bone, etc. Skin, like this one, right? You can see hair. Right, you can see hair here. So basically, teratoma, monster tumors where you can find almost anything on earth. Okay, so when you can find hair, skin, have you ever thought that there could be a specialized tissue, the thyroid itself in the ovary? That is struma overi. Okay, then moving on, guys. Similarly, this carcinoid tumor actually produces serotonin, 5-HT serotonin, right? So what is struma overi producing? Thyroid hormone, right? Can lead to hyperthyroidism. Then you have dysgerminoma. Dysgerminoma also is very important. A small wake-up call for you. How is it going so far? What are we looking at? We're looking at the germ cell tumors of the ovary. Very good. So what we finished? We finished teratomas. Now we are moving on to dysgerminoma. Dysgerminoma is nothing but the ovarian counterpart of seminoma in testis. Like in testis, how you study seminoma, in ovary it will be dysgerminoma. Okay. Then you have yolk sac tumor. Even in the male genital system, in the tumors, you have studied yolk sac tumor. So in the female also you have yolk sac tumor. It is called endodermal sinus tumor, or it can be yolk sac tumor. In this you can see Schiller-Duval bodies. Like this. These actually look like glomerulus, don't you feel? Like a flower actually it looks to me. So these are nothing but Schiller-Duval bodies seen in endodermal sinus yolk sac tumor. Guys, you know that we are in germ cell tumors of ovarian tumors, right? In that we have finished teratomas, dysgerminoma, yolk sac tumor. Now we will move on to choriocarcinoma, and then you have others, okay? So no need to go into details of others and all. In mothers, very easily you can just write off mixed germ cell tumors. Okay, what is this choriocarcinoma? Actually, choriocarcinoma means what? It comes from the placenta. But here it can have an ovarian origin. So you can call it as an ovarian choriocarcinoma. Okay. Others, we are done with mixed germ cell tumors. So guys, we are done with the second category of ovarian tumors. What did we see? Germ cell tumors, teratomas. In teratomas, benign, that is mature teratomas. We saw dermoid cyst, etc. In the malignant, you saw malignant or immature teratomas. Then you saw specialized teratomas like struma overi and carcinoid tumor. Then you saw the dysgerminoma. Then you saw the endodermal sinus yolk sac tumor. Then ovarian choriocarcinoma, and others you saw mixed germ cell tumor. Okay. So people, we are done with two groups here. We are done with the epithelial tumors, germ cell tumors. Now we will move on to the sex cord stromal cell tumors. These can arise from the stroma or from the sex cord cells. Okay. That's why they are sex cord stromal cell tumors. In that you will study all the granulosa cell tumors, thecoma, fibroma, Sertoli cell, Leydig cell tumors, etc. These are all the supportive cells around the actual germ cell. Okay. So there can be some tumors associated with these kind of supportive structures. So let us look at the examples here. Granulosa, theca cell tumors. So you have the granulosa cell tumor, thecoma, fibroma. Then you have the Sertoli Leydig cell tumors, androblastoma. Then you have the gyandroblastoma. Okay. Guys, we are not going into the details of this, okay? So you have what and all here. Can you recollect and tell us? Granulothecal cell tumors. So you have the granulosa cell tumors. You have the thecoma, fibroma. Then what else we saw? Sertoli Leydig cells tumor, right? Androblastoma, gynandroblastoma, okay? Now, it is not over yet. We have a few more miscellaneous tumors you should know, like gonadoblastoma, lipid cell tumor, like Y in ovary, lipid cell tumor, my God. Then, metastatic tumors, that means, example, Krukenberg tumor, like from the bowel, it can metastasize to the ovary. So, did you understand what we are trying to say? It is not a primary tumor of this ovary. However, if this is the intestine, okay, and this is the bowel, from here it can metastasize to the ovary. So that is what is Krukenberg tumor, okay. So they are saying it is bilateral signet ring carcinoma metastatic to ovary from bowel. So we are done with the classification of ovarian tumors, guys. So you have seen what and all tumors. In the last, you saw suddenly some two groups, so you might forget that. So you have seen miscellaneous tumors like gonadoblastoma, lipid cell tumors, and then metastatic tumors, that is from other places it's coming here. So you have the Krukenberg tumor from the bowel, okay. This is from the bowel, it is coming to the ovary, okay. What now you should focus on is, you have seen the main three groups: surface epithelial stromal tumors, germinal cell tumors, sex cord tumors. So here, surface epithelial tumors, you should know that these are 60 to 70%. Serous are actually even more common than mucinous. Then, germ cell tumors, 15 to 20% cases. Sex cord stromal cell tumors, remaining 5 to 10% they have given. Okay. So you have understood that which one is more common? The epithelial tumors are more common. Okay. So that's all in ovarian tumors classification. So I think you have taken a lot of information from here. So if they just ask the classification of ovarian tumors, you should be able to write it. Okay. Thank you so much for joining this video. Bye bye.